The awareness at the community level is much, much higher than it was 20, 30 years ago. I think in part that's because we are gradually improving cure rates. For childhood cancer, there are slight increases in the incidence of childhood cancers, but they're very small. It's not like we're having a big epidemic. The attention to childhood cancer is important because it continues to be the leading cause of death by disease in children, if we exclude accidents, for example. And it's an area where we're making tremendous strides. 30 years ago, the vast majority of children died of their cancers. At the present time, we're curing about 75%, and for certain subtypes of childhood leukemia, the cure rate's approaching 90%. We're making great strides, but in part, the easy part of that work is done, and the more challenging, more difficult, more advanced tumors are the ones that we're working on now.
But that's I mean, I'm shocked at that progress. And you said 30 years ago it was 75%?
30 to 40 years ago, only about 25% of children were cured. We're now curing over 75%.
75 and 90 with that's on any measurement, on anything, that would be huge, especially in something like that. And how cooperative do you work with other hospitals? Is it a pretty competitive? I would think it would be, but is it pretty competitive in terms of getting dollars from NIH and others?
Let me tackle that a little bit.
I guess
Dave.
Is 20 different hospitals doing the same thing that if together might be more efficient?
Yeah. The issue of competition is one that's got lots of layers to it. But for example, we don't view ourselves as a competitor for anyone in Oklahoma.
Right.
We view ourselves as cooperative, so that we will cooperate and partner with any institution interested in children. Yeah. And that's more for the local clinical services. Yeah. But then when you get into the arena, for example, of faculty, we have been very blessed, primarily through the Endowed Chairs program, to have recruited faculty from all over the country. And so we've become very competitive. And I might add that we are also blessed that we have lost none of our endowed chairs. So they come to Oklahoma, they love Oklahoma, and stay in Oklahoma. So we're very pleased with that. So that aspect is competitive. The grant aspect is very competitive because it's really a national scientific review for the various grants that we get. So that review process for the NIH occurs at the NIH. And so it is really a highly competitive process.
Yeah. And as a doctor, is that okay? Does it produce the best results, I guess, when you have all these different,
Well, it's competitive at those levels, exactly like
clinical,
Terry
I understand.
said.
It's on the research side.
On the other hand, the major way we've made progress in childhood cancer is cooperating all together. There's a single North American cooperative group, the Children's Oncology Group, and consequently, the research studies that are available here in Oklahoma City are identical to the ones that are available in Dallas and in Houston and Atlanta and Washington, D.C. We all share those cooperative group studies, and that's one of the major reasons that we've made such advances, and it's also one of the reasons to assure that we can provide the very best care for the kids right here in Oklahoma City.
I wasn't trying to create controversy. It was just from the outside, you just see all these different activities. We're going to close here in a minute. Obviously, it's working. We just heard these fabulous statistics on the improvement. One last question for you. You came to Oklahoma City. A couple things that you've really been surprised at, or you like. You mentioned the community support.
Well, the community support I anticipated would be good. It's every bit what I had expected and more so. The generosity of Children's Medical Research Institute has been tremendous and allowed us to now in the process of recruiting laboratory investigators for a cancer research program. The institution is getting stronger. We're in new facilities in the Children's Hospital, which are much, much nicer than we previously had. And we're just getting ready to open a brand new outpatient facility next year that will be one whole floor just dedicated to our outpatient center, the Jimmy Everest Center. So we're really excited.
After the break, we'll talk a little bit about the building. And the new cancer center, are you going to be involved
We are a player in the cancer center. However, for the clinical care aspects, we'll be in the pediatric ambulatory building because that's where it makes sense to take care of the children.
Okay, and after the break, we'll talk a little bit about more with another doctor, a researcher. It is amazing, though, driving by Lincoln in that corridor there and what's going on both on the research and the cranes that are just building more and more, from the cancer center to the diabetes center to the children's hospital. Most of the buildings are being renovated. Not only for good local economy, we're bringing in people, but the care recently was involved in. It's just phenomenal. Now, working for him, did that work out okay too?
Yes.
Okay, good. He's a friend, so I needed to at least check on it.
Been a great golfing buddy.
Well, you know, people really don't realize what's going there because you're so focused. The image and public affairs is not your number one goal there, and so I'm trying to get the message across that this is a unbelievable resource to the state of Oklahoma.
It's clearly something that Oklahoma should be proud of.
Yeah. Let me take a break. We're going to bring in another doctor who's doing some great things in another area of the world of medicine. Dr. Bill Maurer, thank you for coming.
Thank you.
Thanks for coming to Oklahoma City and doing all the great work you're doing. We'll be back in a minute. Welcome back to the show. That first segment was very interesting and informative. I've got Dr. Terry Stoll and Dr. John Mulvihill, who we're going to talk to in a minute about fascinating research. Dr. Stoll, buildings that are going on at Children's Hospital. What's the new tower or office that's going up?
Well, we're in a major building phase now, which is really important for the care of the kids. My office is actually in the 1928 Crippled Children's Hospital, so we've used that building to its maximum benefit, and now it's time to move on to something else. So we last year moved into a newly renovated children's hospital that has 100% private rooms, which is a big plus for caring for entire families. And now the new building that's going up is a 330,000 square foot, 14-story building that will house all the medical and surgical outpatient care. It'll have radiology, including CT scans, and it'll be conveniently located immediately next to the parking garage. So it's going to bring children's health care into a coordinated focus to allow us to then really practice at the highest level.
Quick answer to this question. When that's done, how will that compare to other children's hospitals, just in terms of size and scope?
Oh, I think we'll be as good as any place. And in fact, one of the very interesting things to watch is the new lobby atrium. I'm curious, someday someone will do the analysis, but it will be one of the largest lobbies in the state. It's a beautiful, wavy top, almost waterfall design. It's 6 stories tall and I would guess about 100 feet across. It's massive and beautiful, and it makes a really strong statement for children.
And when will this be finished, this building?
The building itself should open in a little over a year, and then after that, the lobby and the atrium will be built, and in addition to that, an entire education center.
Wow. I don't think people realize what's going on there. Dr. Mulvihill, it's a fascinating field. You are the chair for genetic research?
Yeah, I'm the Children's Medical Research Institute Talley Chair in Genetics and Professor of Pediatrics.
And what brought you to, when did you come, and what brought you here other than Dr. Stoll, we know?
Oh, Dr. Stoll's a magnetic